Welcome to Arirang TV's special coverage of the COVID-19 pandemic. I'm Min San-hee. The world is taking drastic steps as part of efforts to curb the coronavirus, and we're hoping to set up a platform here as part of efforts to provide you with productive information on the COVID-19. Now, joining me in the studio with that particular task in mind, I have Kwon Soa and Noaram. Welcome.
Good afternoon.
Let's start with you, Soa. I understand numbers have been dropping again today, but government officials say this is no reason for relief.
Right. According to the latest briefing by the Korea Centers for Disease Control and Prevention, we do have a slight a rise in new cases compared to yesterday, but remaining in the double digits. Now, a number below 100 is no sign of relief, authorities say, as the spread has definitely not been contained yet. Now, the new cases also include 20 from abroad, as some more than 1,200 people arrived from Europe yesterday, with 101 people showing symptoms. Now, the total number of cases now stands at more than 9,037, as 76 more cases have been added, and 9 more people have died of the disease, bringing the total number of deaths to 120. And in the meantime, 341 people have fully recovered in the span of a day, bringing the number of people discharged to 3,507. Now, let's take a closer look at the cases by region. Now, in Daegu, we've got 31 new cases, and in Gyeongsang-Buk-do Province, 1 case, 15 in Gyeonggi-do Province, 4 in the capital Seoul, 2 in Busan, in Incheon, Chungcheongbuk-do Province, and Gyeongsang-Namdo Province, we've got 1 more case each, and the total number of confirmed cases in Daegu stands at 6,442, Busan 111, and Seoul we've got 334 cases now.
I see, which is precisely why the government is asking people not to let their guards down.
Exactly. And also earlier this morning, Prime Minister Chung Se-kyun renewed the importance in implementing social distancing. During a meeting at the Central Disaster and Safety Countermeasures Headquarters, he stressed how one person's unwariness can cause unrecoverable damage to another person and destroy a whole community, calling for the nation's people on continuous cooperation. And he noted how the majority of the people are abiding by social distancing measures, but the improving weather conditions make families and people carefully go out to enjoy activities at crowded places, as well as visits to clubs. There he was especially referring to the younger people. And there is, in fact, a wide belief that the fatality rate of people below 40 is low. Now, meanwhile, on the economic front, at an Emergency Economic Council meeting today, President Moon Jae-in announced an emergency funding aid package of 100 trillion won, or roughly $80 billion, with a big focus on preventing businesses from going bankrupt. And that is actually double the amount the council agreed upon on their very first meeting last week.
I see. What about the situation elsewhere around the world?
Well, while it is really difficult to grasp the exact number of cases and deaths due to the exponential rise in cases, more than 370,000 cases have been confirmed, according to Johns Hopkins University data, along with more than 16,000 deaths. Now, in the U.S., more than 41,000 cases have been confirmed, with more than 500 deaths, 10,000 new cases in a day, and out of these total cases in the U.S., more than 20,000 are in New York alone. In Italy, it's very serious, where hundreds of people are dying a day. It's become even difficult to deal with the dead bodies there. And another serious spot is the UK, which has called on its nationals to immediately return home from travel, and has also followed suit in canceling its participation at the Tokyo Olympics, just like Canada. And another serious spot is Spain. In fact, the death toll in Spain and Italy together stands at over 8,000. Right. And meanwhile, due to the dire situation abroad, South Korean airlines have in fact suspended flights, including Korean Air's routes to Beijing. And there are more calls on stricter travel measures to be implemented, not only to people coming in from Europe, but also from the U.S. And meanwhile, the G20 world leaders are also expected to discuss the pandemic to come up with an action plan. And that would also, of course, include South Korean President Moon Jae-in.
Right. So though the COVID-19 cases have been slowing down somewhat in Korea, the rest of the world is still battling with the number of cases and deaths. Korea's foreign ministry is asking people here to refrain from traveling overseas. We have Adam with more on that.
Yeah, so the ministry issued what they're calling a special travel advisory, urging Korean citizens to either cancel or postpone any planned trips abroad. The advisory applies to all countries in the world, except for those that are already under higher alert. So those where the Korean government has urged citizens to either withdraw from that country or countries that have travel bans in place. It also calls for people to stay outside, for people who are staying outside Korea to take extra precaution for their safety. And the special advisory is valid for the next 4 weeks unless it is extended, which is a likely outcome at this moment, but 4 weeks as it is now. Not only is there a risk of Koreans contracting COVID-19, which is one of the reasons why this advisory is in place, overseas travel would be pretty much impractical at this moment because many countries, as I said, have issued travel restrictions or entry bans on those traveling from South Korea. And this could see Koreans planning to head abroad having their flights cancelled or postponed. Their schedules will be all muddled up, so it would be impractical, as well as the possibility of quarantine once they arrive in those respective countries.
The outbreak, of course, is hurting the Korean economy, but not just that, it's also wreaking havoc on the global growth. I understand the IMF has painted a rather grim portrait.
That's right. The IMF chief, Kristalina Georgieva, says the pandemic could be leading to a recession for this year, one that is worse than what we saw during the 2008 and 2009 financial crisis. She, however, did note that the world economic growth output could recover in 2021. In order for that to happen, she said there needs to be what she called an unprecedented response. So that means such as prioritizing containment and strengthening health systems worldwide. She also called on advanced economies to provide help and more support to developing countries, which will see a massive outflow of capital in trying to deal with this pandemic. And she also praised the extraordinary fiscal actions already taken by many countries to boost their health systems and protect affected companies and workers. Georgieva added that the IMF stands ready to also deploy its $1 trillion lending capacity as well. So the IMF is also trying to hand out a lending hand.
Right. Another word popping up these days is the word infodemic, a play on the word pandemic. Fake news leading to people endangering themselves.
That's right. We've had a lot of these fake news stories where people have actually felt gullible to them, and it's leading to some detrimental health issues as well, not just outside rather than the virus itself. These other kind of health issues. The latest incident is where fake news proved to be damaging in Namyangju, east of Seoul. A woman and her 2 children were hospitalized after earlier this month after the mother was found to have disinfected her house with a methanol water solution. So spraying it all over the house in order to disinfect against COVID-19, the misbelief that it would disinfect against COVID-19. And they were hospitalized for symptoms such as stomachache, nausea and dizziness. And there is a mistaken belief that this industrial-grade ethanol would ward off the coronavirus. But experts say that this is totally false and can pose a major threat to health, as it has proven to do so. Korea is not the only country, though, where methanol poisoning has taken place. More than a dozen people in Iran have actually died after drinking industrial-grade ethanol, thinking that they would cure the coronavirus. And earlier there were also a cluster infection here back in Korea in a church in Gyeonggi-do province where the congregates were sprayed with salt water of the misbelief that it would cure the COVID-19, but since the nozzle with the spray was not disinfected itself, it wasn't cleaned, and it was sprayed amongst many people, it actually resulted in about 70 people being infected just from that means alone. So So that's also another cause for concern, these cluster infections as well. And these cases are coming out due to these false stories, which are circulating online and on social media as well. So it is a cause for concern. And it is important for the public to first check whether information is verified from verified sources and whether it is scientifically proven and if it is coming from trusted sources as well.
Right, Adam, thank you for that. Now, it's a little after 2 o'clock here in Korea. Normally we'd have our briefing by the Central Disaster and Safety Countermeasures Headquarters at about 2:10. But it appears that the briefing has been delayed to about 2:30, so we'll go back to the briefing center headquarters, that is, later on in the program. In the meantime, we had right, Aram, you were talking about the severe situation with fake news. That apart from information in Korea, I'm sure this is a case for like other countries around the world as well.
Yeah, so as I said, in terms of Iran, we saw those, I think it was 16 the last time I checked, deaths coming because of this ethanol-based, anything industrial grade ethanol. They were drinking alcohol as well. There's also been some really crazy stories about cocaine as well. Some people putting out these stories from a fake news outlet. There's this website that encourages fake news, people to write these fake news stories, and one of those stories was that cocaine could actually help COVID-19, and we all, of course, know that that is simply not true. And not just cocaine, but some other grade A drugs as well. I think people are just trying to find an excuse to recreationally to use these drugs recreationally, and so the health authorities are urging against that. And I think it just comes down to common sense at the end of the day. I mean, obviously, cocaine and all these harmful substances will not help cure the COVID-19 virus.
Right. Now, as I mentioned earlier on, the briefing by the Central Disaster and Safety Countermeasures Headquarters has been delayed to about 2:30 Korea time. We'll be back with news on that in a little while. Right, in the studio today we have a former ranking official from the Centers for Disease Control and Prevention, who is currently professor at Hanlim University, to share his thoughts. Welcome, Professor Jung Ki-suck. Thank you for making time today.
Thank you for having me.
Professor, how do you assess the current COVID-19 outbreak in Korea?
I think these days the epidemic is under control somehow. But I suggest, and I suppose that some two-digit number or some number between up and down 100 will be continued for a long time. And another factor is from viruses from abroad.
Professor, Korea's Gyeongsang-Bukdo province, which was once the country's epicenter, reported just one new case as of midnight earlier today. What are your thoughts on this?
That's a very good news. That is from because the local government did a very extensive and thorough investigation all through the region. But I suppose still there will be some local outbreaks here and there for the time being.
People believe the symptoms of COVID-19 and the seasonal flu are similar. What are ways of distinguishing between the two, Professor?
It's very difficult to differentiate between two diseases. For me, I have lots of experience with URIs, influenza, pneumonia, but I cannot tell which is COVID-19 and which is other. But you can tell it's like a flu symptom, but it's not like a usual flu, which you have gone through. It's a bit different. You have a headache, very severe throat ache, and sometimes loose stool diarrhea, and etc. So if you feel a different URI symptom other than before, then you can suspect the COVID-19.
I see. What about the differences between COVID-19 and pneumonia?
Yes, more difficult. COVID-19 also causes a pneumonia, but the COVID-19 pneumonia is different from other community-acquired pneumonia in some points. One is it progresses very rapidly. In 4 or 5 days, he or she has a very severe respiratory distress syndrome with COVID-19. And some pneumonia, even you have a pneumonia, you don't have any symptom. You don't cough, you don't have a breath, and etc. So it's a very peculiar disease because it's a very, very new virus to whole mankind.
I see. I understand that nearly 80% of the COVID-19 patients report mild to moderate symptoms, and some of them do not require, of course, intensive care. But the mortality rate continues to rise. What are your thoughts on this?
I think it became a natural mortality rate because we started from 1% of mortality rate from the beginning, but we did lots of studies, particularly in Daegu, Gyeongbu area. And even the study included the no symptom population. So we made the big denominator. Then we could see a case fatality rate down to 0.6%. It's not the usual thing. Then we are recovering to a 1% plus minus. I think this is average figure in Korea so far. And if you continue 1% around on the mortality rate, I think we are doing very well compared to the other countries' mortality rate.
I see, and hopefully that will continue. In addition to the shortage of face masks here in Korea, pharmacists have also sold out on Tylenol. Now this follows experts. There were some experts who talked about how Tylenol can be used to treat COVID-19 symptoms. What are your thoughts on that?
Really, the Tylenol is very familiar to me, to all people, and it's very abundant here and there. I don't think it's very on a shortage. But the story is from NSAIDs, non-steroidal anti-inflammatory drug, which is another kind of antipyretic, anti-pain drug. And some NSAIDs could induce ACE2. And if you have a lot of ACE2, then COVID-19 virus can attack the ACE2 receptor. But still, it is not confirmed, so don't worry too much about that.
Professor, we've just learned that more than 20% of the new patients in Korea are from overseas. How do we better deal with the influx of the so-called imported infections?
Yeah, from a preventive medicinal view, it is far better that we block our border. Then we can manage domestic people until we can control whole things. But things are not going like that. So we are going to do a bit more intensive way. Then we can pick the people and segregate for some time, say the 14 days and etc. Do a test. And I like to do this kind of quarantine at least coming 2 weeks, because this is a very nice chance for us to do social distancing and doing personal sanitizing and etc. So I like to suggest that 2 more weeks is very important, and we should do everything we could do.
Professor, you previously served as the director of the Korea Center for Disease Control and Prevention, and you oversaw the MERS outbreak back in 2016. What can you tell us about the preparations that have since been taken by the government in anticipation, perhaps, of another outbreak such as this?
Yeah, I started my service just after the end of MERS, and we started to establish 2 new centers for the coming next epidemic like this. So the one is Public Health Emergency Preparedness and Response Center. And in the center, we are operating Emergency Operations Center, which is very active nowadays. And the second one is a Laboratory Center for Infectious Disease. You know, the reason why we could do lots of testing, COVID-19 testing studies as early as possible, because we made the fast track after MERS. When MERS broke out, we couldn't do a rapid procedure due to a certain restriction within the government. We made a fast track, and everybody was ready for COVID-19 virus testing. So that's why we are doing a very large amount of study every day compared to the other countries' situation.
I see. So we have you to thank for the fast testing system here with regard to COVID-19.
Yeah, and we have made further advance for risk communication and for EIS, which is Epidemic Intelligence Service reinforcement, and etc. But still, we need further management when you're handling infection control.
Professor, speaking in your capacity as the former director of the Korea Centers for Disease Control and Prevention, what further measures should be taken by Korea at this moment, given the slight dwindling in numbers of confirmed cases?
There will be 2 tracks. One is the containment strategy. The other one is mitigation strategy. I suggest still the containment strategy is useful. And that is find the patient and treat, and find a close contact and segregate them, and keep continuing doing that. And the another one, the mitigation, is a bit abandon prevention of epidemics and etc. So still, they are doing very well. Korean Center for Disease Control is a close contact. People will forget about population will be infected. And we cannot tolerate the utmost goal at this situation is to prevent massive occurrence of COVID-19 infection.
I see. So to keep it within a limit that we can actually deal with and control, the medical staff can deal with. Professor, my final question to you is something I've also personally been curious about. New research shows that warmer temperature may help to slow the transmission of COVID-19, which is why we're hoping that in the summer, the outbreak might subside. What are your thoughts on this?
Yeah, I hope. Yeah, my guess was maybe beginning of July, we're having a very low instance. But I think the epidemic could be strong enough to penetrate the summer. And looking at the US and EU and other countries, particularly the Southern Hemisphere countries, Australia, African, South American, they are in the beginning of epidemic. Then maybe the viruses from abroad cannot be prevented for us. So we'll be continuing until maybe by the end of this year.
I see. Okay, Professor, thank you very much for being with us here today.
Thank you.
Now, perhaps no other example best illustrates Korea's innovative diagnostic and quarantine measures than the country's drive-through testing centers. They're now being adopted, that is, by many countries and have earned high marks for being quick, safe, and convenient. These testing centers were the brainchild of Professor Kim Jin-yong, who is also in charge of treating Korea's first confirmed COVID-19 patient. We have more in this report.
의료기관에서는 한 명 검사하고 최소 30분, 보통 1시간 정도 공간을 비웠어야 되는데 이 방법으로는 보통 10분 정도, 한 명 검사하는데 10분 정도 이내로 단축을 할 수 있고 때에 따라서는 들어오는 라인을 여러 개 설치하면 그것보다도 훨씬 더 빨리 검사를 할 수 있는 장점이 있습니다. 우리나라 이제 유행 초기에 갑자기 이제 환자들이 많아지면서 빨리 검사를 해야 되는 그런 이제 필요성이 있었습니다. 그 전에 이제 제가 연구했던 과제 중에 생물 테러시의 약품 배분소라는 게 있습니다. POD라고 하는데, Point of Dispensing이라고 하는데, 그래서 그 POD을 이제 설정하는 그런 연구에 착안을 해서 야외에서 검사하는 것이 자연 환기를 통해서 다음 환자한테 오염되는 것을 막겠다 이렇게 생각을 했고, 그렇게 하다 보니 이제 자동차가 지나가면서 자기 차는 자기 거기 때문에 오염이 되더라도 큰 문제가 없어서 그렇게 하는 거를 생각을 했습니다. 신속하게 하는 대신에 한 가지 이제 유의점이 뭐가 있냐면 검체와 검체 간의 교차 오염 가능성이 있습니다. 따라서 매 환자마다 검사에 사용한 장갑이라든지 일회용 앞치마 이런 거를 매번 교환하는 것이 상당히 중요하다고 할 수 있습니다. 지금은 겨울에서 이제 따뜻해지고 있지만 조금 지나면 여름이 될 거고요. 그런 기온에 되게 민감하기 때문에 검사자가 주의가 필요하고요. 조금 슬픈 소식이지만 미국 전역에 코로나19가 유행을 하고 특히 뉴욕 중심으로 해서는 거의 중국의 우한시 초반과 비슷할 정도로 폭발적으로 환자가 늘어나고 있고 실제로 저도 주말에 그 뉴욕에 있는 모 병원에 있는 의사와 이메일로 진료 경험 같은 거를 같이 공유하기도 했습니다. 예전에는 논문으로 적어서 글로 올라오는데 몇 달이 걸렸다면 지금은 신속하게 거의 뭐 날마다 이런 내용들이 공유가 돼야 될 겁니다. 이거는 저희 현장에서 겪고 있는 공조라고 생각을 하고요. 또 한 가지는 이제 제한된 자원, 전 세계가 같이 공유하고 있는 제한된 자원 그런 것들이 어떻게 하면 효율적으로 쓰였을까 그런 것도 생각을 해봐야 될 겁니다. 그거는 물적 자원도 있고 인적 자원도 있고 또는 지적 자원도 있을 겁니다. 이런 것들이 잘 나눠서 쓰이는 것이 상당히 중요할 거라고 생각이 되고요. 우리가 지구상에서 이 바이러스를 안 지가 이제 3달이 돼 갑니다. 그 3달 동안에 정말 많은 전 세계 학자, 의사, 연구자들이 이 바이러스를 이해하기 위해서 노력을 하고 있고요. 하지만 그 많은 전문가들마저도 일부의 나라는 대응이 실패를 했고 일부의 선진국들도 허둥대고 있는 것은 마찬가지입니다. 너무 과도한 공포로 모두 다 얼어붙어 버리는 그런 일보다는 정부의 지침이나 학계의 지침을 잘 귀 기울여서 현명한 방법으로 지금 이렇게 모두 차단된 그 사회적 거리두기에서 조금 더 준비를 한 상태에서 차근차근 우리 일상으로 돌아갈 방법을 찾아야 됩니다. 그게 우리가 앞으로 가야 될 길인 것 같고요.
Right, it's about 2:30 in the afternoon here in Korea, and we are standing by to tune into the regular briefing by the Central Disaster and Safety Countermeasures Headquarters on the latest facts and figures on COVID-19 situation here in this part of the world.
Let us now begin our regular briefing for March 24th, a Tuesday on the coronavirus outbreak here in South Korea. As of today midnight, the total number of confirmed cases stands at 9,037. This includes 171 imported cases. Of them, 3,507 have been discharged following full recovery. We had an increase of 76 from the day before, and those who have been discharged was up by 341 from yesterday. And by regional distribution, Daegu City has the largest outbreak. largest increase, with 31 from yesterday. Nationwide, 80.4% were related to cluster infections, and the remaining were related to sporadic outbreaks. And in the Seoul City Gurogu District Call Center, we have identified over 160 cases with 2 additional cases. And in Gyeonggi-do Province, Gulpo-hyo Nursing Hospital, we have identified an additional of 14 new cases. And in Daegu City, we have conducted and finalized our enumeration investigation on the high-risk facilities, which centering around nursing homes, and we conducted about over 30,000 screenings, and we have identified about 23 new confirmed cases. And starting from the 22nd of March, we have expanded our special entry procedures, which mandate all inbound travelers from Europe to get these screening testings. And yesterday we had about 12,000 people who were coming in from Europe, and of them 101 people had symptoms. And starting from today, in order to prevent the further spread of the virus and to have more effective measures of the expanded entry procedures, from 2 p.m. today, we will have all of the Korean nationals who are coming in from Europe to be self-quarantined at home. And as for foreigners coming in from Europe, they will be screened after they are transferred to the temporary accommodations. And they will be quarantined in these facilities, and for those who are staying a little bit longer here in Korea, they will be under active investigation and monitoring. And about 90% of the inbound travelers from Europe are Korean nationals. They include people who are studying abroad, those who are working in overseas expats, as well as their family members. Of the confirmed cases, today we had 76 new cases. Of them, 23 were related to overseas infections, which account for about 20%. In particular, as we are seeing the increase of imported cases from Europe, we need to ask for those to have extra precautions for their safety. And Europe topped the list from imported cases, and US came second, and a lot of the cases were also identified at the airport quarantine. And relating to the R&D procedures, the KCDC has acquired a large sum of budget through which we will be carrying out clinical trials, and this will be utilizing many other vaccines as well as antibiotics in order to use and utilize as well as come up with vaccines as soon as possible. And we will also focus on our R&D on developing vaccines utilizing already developed therapeutics. The KCDC currently, as we see the prolonged outbreak of the coronavirus globally, and we are seeing an increased number of cases here in Korea as well. We have been intensifying our social distancing measures, and I would like to ask all of the public to abide by our measures until April 5th. So please stay at home and refrain from going outdoors if it's not necessary, like commute to work. And for businesses, we urge you to utilize measures like distancing people as well as flexible working hours to prevent the further spread of the virus. And we also advise indoor sports facilities and other religious facilities to close down the facilities for the time being. Thank you very much.
A little more than 2 months have passed since Korea reported its first case of COVID-19, with the crisis here peaking in late February after a series of mass infections broke out among followers of the Shincheonji sect, turning the country into a new epicenter of the virus. However, Korea has since turned a corner, and it's now being regarded as a role model by counterparts worldwide in containing the outbreak, thanks to many innovations in testing and research. Now, for more on this, in the studio, we have Frederick Ojadius, journalist for Radio France International,
Hello.
and Lee-Yoon Jin from I1Bio, a firm that is now exporting fast and easy COVID-19 testing kits. Welcome to the studio.
Hello.
First, Fred, what are your thoughts on on Korea's drive-through testing centers that we saw earlier in the program?
Well, that's impressive, and what's really interesting is that how it was set up very rapidly, and I mean it's a brilliant idea really, because I mean we know now like hospitals are a place where you can catch the disease. I mean in Italy, one of the things we learned recently that they are the main vector of the epidemic, the hospital themselves. So as a person who is maybe worried of being infected, you don't want to go to the hospital, but if you stay in your car, you can be tested rapidly and safely. And it's interesting because, I mean, it's no wonder that now we see this drive-through model being applied in so many countries outside of Korea.
Right, that is true. While many businesses are struggling amid the outbreak, those related to medicine and hygiene, I suppose, are faring probably better. What are your thoughts?
As a test kit developer, we have been definitely very busy. We have been working day and night for the past 2 months since the first outbreak. We're currently receiving orders, and we're communicating with more than 20 countries right now, including the US, UK, Switzerland, Italy, and Kazakhstan, and India. And they're all large orders, over 50,000 test kits. And some countries are even asking if we can provide 500,000 test kits per week. So there's definitely a surge of orders right now. And we're trying to respond to all of the countries that are in need of our rapid test kits as fast as we can. And I also heard that other Korean test kit companies are also starting to receive large orders from many countries as well. It also small items like the vial tube, which is used for the storage of our test kit reagent, are running out right now. So definitely we're working very busy trying to cope with the surge of requests as fast as we can.
Right. Fred, the situation in France, it's worsening every day, and recently there was the nationwide lockdown order that was imposed. I also understand the Cannes Film Festival has been cancelled. This is the first time in its history.
Oh yeah, I mean Cannes is the least of our worries right now, to be fair. Yeah, France is in trouble. Yesterday the Prime Minister announced, like, of course we're in a lockdown, France is in lockdown for more than a week, but they will strengthen the measures because it's not enough. The last figures I have, in the last 24 hours, we had more than 3,200 new cases of contamination, 186 deaths, and the total number of people with contamination right now is more than 20,000 people. And that's just the official number, because France does not test enough people so far. So, like, our hospitals and health officials, they're running blind because we don't know how spread the disease is, because we don't have enough testing capacity. And so far, France, there is 860 deaths. Still, the situation is better than our two neighbors, Italy and Spain, who are really now suffering greatly, and it's really, really worrying situation. The biggest problem France is facing now, we don't have enough masks. Even for people, the health people, the doctors, nurses, even for them there are not enough masks. There is not enough testing capacity. There is not enough sanitizing gels. I mean, really everything is missing. And I really want to hear what you have to say about how much testing kits you can produce.
Right, and before she tells us more about that, I was wondering, I understand that COVID-19 testing looks for the presence of genetic materials in a person's cells. Can you explain that in more simple terms for us?
Yes, the detection technology can be largely divided into two methods. First is antibody test, which is kind of similar to a pregnancy test. So it's very quick and you can see the results within 10 minutes. But the downside is that it's low accuracy. It has a low accuracy of 80%. So that's why the other solution, which is the molecular diagnosis, also called DNA amplification, or real-time RT-PCR technology, is more recommended to accurately detect the coronavirus. And the RT-PCR technology, the RNA specimen collected from the nasal swab, we amplify the RNA samples and then through different temperatures. And then that's why through those amplifications, we're able to monitor the results. But also, because of that, it has the advantage of high accuracy, but the only downside of that technology is that it takes a minimum 2 hours to analyze the result. So now we're looking at real-time RT LAMP technology, which is the same, which is based on the same DNA amplification method, but the RNA is amplified at a constant temperature, which reduces the testing time, and we can have higher accuracy and higher sensitivity. So these are the available solutions available on the market right now.
There are also reports that Korea is developing a new testing method for the virus in which you can get results in like 15 minutes. What are your thoughts on this?
Well, I think South Korea definitely realized the seriousness of coronavirus very early on. We took actions faster than any other countries in the world. And because of this, a lot of high accuracy test kits were developed from the beginning of the spread. And especially with our real-time RT LAMP technology that I just introduced, we're able to reduce the analyzing time dramatically down to 15 to 20 minutes. And this can also mean that we're able to conduct 288 tests in an hour with just one instrument. Also, with the high sensitivity that our technology has, we're able to detect asymptomatic cases as well right now.
Oh my, I see. Fred, the Wall Street Journal published a story last week claiming that Korea's enormous COVID-19 testing capacity stood in stark contrast to those in the US and Europe.
Yeah, I mean, in France too, the coverage of the way Korea answered to the crisis was very impressive. I mean, every single media ran stories about how Korea managed to do that. Korea had a peak and they managed to control that spread, and they didn't resort to measures as severe, as draconian as you can see in China, for example. Here, even Daegu, the local epicenter of the epidemic, was not in full lockdown like Wuhan was. Korea never really closed its border, even at the peak of the crisis. So, of course, people want to know, and there were many articles in the French press explaining the key, what we think now are the key reason behind this success. Of course, the high testing capacity, the fact that people wear masks. And I do think, I think there has an impact too. And just back for the testing capacity, to give you an idea, now in Korea it seemed that 330,000 people got tested. In France, it's 10% that number. And even though like the number of people who are contaminated is probably much, much, much higher. So we are really lagging behind, and we want to understand, like French people want to understand how Korea managed that.
Of course. Which is why perhaps I'll give you an opportunity to ask our expert here on some details. Do you have any questions you'd like to ask her?
I mean, I'm curious right now. I mean, I would have many questions. You mentioned that your very fast test kit has an 80% accuracy. It seems pretty low to me. Like, why 80% is still useful in fighting the epidemics? And my second question, I would like to know how much tests can you produce? Like, how many? Yeah, what is your production capacity right now?
Right now, we're able to produce over 1 million tests per month. But depending on the urgent needs, we're probably able to reduce more in the future, probably by April.
Okay. And the fact that, can I?
Of course, go
the,
ahead.
The fact that you say like 80% capacity, this accuracy.
Yes.
Well, could you explain why is it still useful even though the accuracy is not perfect?
Because of the fast test time, because we can see the results within 10 minutes. So as like the primary test, people want to see the results fast enough so that it's considered as a primary test, but not the most accurate test available.
Okay, I think that's about the time we have for now. Thank you again, Fred and Lee Yoon-ji, for being here with us today. Right, well, that brings us almost to the end of our program. We'll be back daily at this hour, so be sure to join us then. In the meantime, Arirang TV welcomes feedback, questions, as well as messages from our viewers regarding the COVID-19 outbreak. So do check out our homepage at arirang.com or follow us on our social media accounts down below.